All right. Good morning, Melissa. How are you?
I'm doing great. How about yourself, Lauren?
Good, good. Thanks for meeting with me this morning. I appreciate it.
You as well. Thank you.
Awesome. So, I know we chatted a little bit before this call, and I want to get some details on your previous work history with Humana. You mentioned you were there for a really long time and held a couple different roles. So let's start off. When you first started with Humana, it looks like you were an administrative coordinator. So talk to me a little bit about what that looked like and what you did.
Okay, great. Yeah, that position was more or less managing the office, the staff. I worked on the clinical team as a non-clinical staff, so I would be responsible for, meeting schedules, setting up different calls. We also had to, manage, I guess you could say, regular office type related issues such as data entry. We had to do a couple of calls to different facilities or doctors' offices to request member information. And we also screen calls from members when they would call in needing assistance from a nurse or any of the medical staff. We would screen those calls and then triage them to the correct person.
Okay, perfect. And then from there, you moved into more of a leader supervisory role um, with the non-clinical guidance specialist. So what did that look like?
So that was on the same team, and so what I just moved into more or less like you said, a management position. So I had about five staff members that would be under me, and we were all the non-clinical staff. So it kind of still stayed with the same, managing the roles of them calling the different facilities. We called facilities throughout the state of Florida to request member information. The same thing, doctors' notes, things of that nature. We would access the medical systems to pull records as needed. And then I managed that team, but I would also, do the calls as well. We also did things such as denial letters, approval letters, anything related to the member service and items that they would need to function.
Okay. Yeah, and then we had kind of mentioned you with working with different EMR systems. You have done that, but it varied depending on what hospital or medical facility you were working with, correct?
Correct. Yes, mainly in the North Florida area, I would say like Halifax. I think it was Birdfish. A couple of facilities they would give us access to their systems with a password, protection.
Sure.
Also, I think Orlando Health, and we would access it that way.
Okay, awesome. And then most recently, you were provider contracting professional. So, what does that exactly mean?
So in that role, we would be more or less the face of gathering providers to contract with Humana. So my team mainly dealt with specialists. So it would be like the cardiologist, I guess you say the ear, nose, and throat. Um, Also, some of the ASC centers and urgent care centers were kind of the specialties I dealt with. So that would be more or less you're the face that provider would come to when they need a new contract, or even to negotiate their current contract when it comes to their reimbursement rates, things of that nature. If they had claims issues, you'd have to also manage that and triage them to the right area once you did research. So it was more or less like you were the face for the provider to communicate with Humana.
Okay, great. So, one thing, I do want to ask you is moving into your next position. What's something that's important to you and what you're looking for?
Definitely looking for, I guess I would say a company that's kind of compatible with what I was with previously, as far as, having a good reputation in the community, also being able to work together and work as a family. I kind of really enjoyed the environment. We kind of moved to working at home, but I do prefer, or I'm okay with the office setting because I love, being in contact with people and being able to assist them in any way, but kind of also build that network and familiarity with being on a great team of people that work together and love what they do.
Okay, perfect. Awesome.